Hello, I'm Dr. Maud McGill, and a part of McGill Ministries focuses on not only the spiritual health, but also your physical health. My PhD is in nursing education and administration, and a part of my research looks at patient education and how can you be the healthy you that you were created to be. God's word says that our bodies are His temple and that we are not to destroy His temple. And so it is important that we take our health into consideration. Your health really does matter. Today's topic will look at hypertension. This is otherwise known as high blood pressure. In high blood pressure, there is a series of a mismatch between how fast your heart is beating and the volume that you have in your body. So sometimes it can be two different parts. Your heart is either beating too fast, or we have too much plaque or too much blood, and it's hard for the blood to get down to the bottom of the feet and to perfuse throughout the body. Either way, this is an issue because every inch of our body needs the perfusion and the nutrients that the blood has. So the first question, what is hypertension? Hypertension is that mismatch. And it's also known as a silent killer because most people who have hypertension are asymptomatic. This means they have no signs and symptoms that their blood pressure is actually up. Now, you often hear people say, well, I know my blood pressure is up because my eyes get blurry or my head starts hurting. But in actuality, your blood pressure is causing minor damage in your body, and it can progress to being major damage if it goes untreated. The reason your head is hurting, the reason your eyes are blurry, is because you're already having some damage to your vessels. And so that's a symptom, but it's also a sign that you're not actually getting the treatment options that you need. For most of us walking around, we may not know that our blood pressure is elevated because our body gets used to the critical state that it is in with the blood pressure. This is why it is very important to either A, go to health fairs, B, keep your appointments with your physician and allow the clinicians to check your blood pressure, or C, go out and purchase a blood pressure cuff. It is warranted that you keep a check on your blood pressure periodically to make sure that you're not falling within the different stages of blood pressure and that your body is not compensating like it should. Number 2 question says, what are the risk factors for developing hypertension? If you are African American or Mexican American, you have a high prevalence of blood pressure issues in your family just from genetics. Another risk factor we like to call modifiable risk factors because these are things that you actually could change. And one thing you could change is if you smoke, you could stop smoking. Smoking cessation is one of the key things we talk about in hypertension because when you smoke, all of your vessels constrict. Yes, the nicotine relaxes your mind, but the other chemicals that are in the cigarette causes a lot of harm on your body. And so smoking cessation, or to stop smoking, is one of the first things we talk about. If you are overweight, then we talk about diet and exercise and trying to avoid foods that are high in sodium. A lot of people say, well, I don't add any salt to my food. But salt alone is not what constitutes sodium. If you purchase foods that are frozen, or if you purchase foods that are in cans, those foods have high contents of sodium. Go and look at a pack of ramen noodles. See how much sodium is in that package. It's over 500 in some, and that's the low sodium packets. Go look at a can of green beans and see how much sodium is there. Now you may say, my income does not allow me to purchase foods that are fresh. If you have to buy canned foods, rinse those foods off first. Don't cook it in the juice that it comes in the can, because that's packed full of preservatives. Rinse the food off with water and then cook it in water, and be careful on how much salt you add to it. Other modifiable risk factors could be, do you exercise? When you exercise, you increase your good cholesterol. Yes, there are 2 types. There's a good cholesterol and a bad one. Bad foods increase the bad cholesterol. Exercise is the only thing that we really find that increases the good cholesterol, and eating green leafy vegetables. What are treatment options for hypertension? Your physician will probably start you, if you're diagnosed with that, he'll ask you to exercise or to try to lose some weight. And if that doesn't work, he'll start you on a diuretic. Now with this diuretic, the first initial one, if it's a thiazide like hydrochlorothiazide, that diuretic is going to be potassium sparing. That means you don't need to eat any extra foods in potassium because there is a risk of you actually having too much potassium, what we call hyperkalemia. Then, if that doesn't work, he'll put you on another medication that either A, targets the kidneys, like an lisinopril or losartan, or he'll put you on another medication that will target your heart, like Norvasc or a beta blocker. These medications are therapeutic if you take them at the same time every day and you get the dosage in your system. It's important that you do not miss these medications. And if you are on a pill that targets your heart, that you check your heart rate along with the blood pressure that you're checking. Of course, watching the sodium that you ingest and diet and exercise regularly. Exercise is defined as any activity that causes exertion for at least 30 minutes. So if vacuuming the floor gets your heart rate up, do it for 30 minutes and you have officially exercised for that day. 30 minutes or greater. But it's not every other day. It says for most days of the week. So do something to get your heart rate up at least 20 to 30 points over your minimum so that you can start having healthy vessels. Long-term complications of not managing your hypertension include organ failure. The number one organ failure that we see is the kidneys, because your kidneys have a filtering unit called nephrons. And once your blood pressure is up, the nephrons no longer are able to filter like they're supposed to. Basically, they're destroyed. And so now, when you destroy a nephron, there is no regeneration, meaning it doesn't grow back. So if you destroy 25% of your nephrons, your filtering unit in your kidneys, that's 25% you don't have in that kidney. Once you get down to 15% of functioning nephrons, that's when they start talking to you about dialysis. And as a Christian, as a believer, as a people who should be concerned about their physical being, it is important that we are proactive. Proactive means we try to address situations before they happen, rather than reactive and address a situation after it's already occurred. Your health truly does matter. There are things that you can do to prevent complications from happening. So we talked about kidney failure being one. Another one is stroke and heart attack. Those are big ones when it comes to hypertension that is not resolved. It is important that you understand that you should advocate for your health. You have to get healthy for yourself because your body is a temple of the Lord. If you have any questions or concern, please feel free to comment below. I do appreciate your time and listening to me on today. Thank you.